Good morning, everybody. Welcome to Mancoll Minute. Hope your week's gone great. Again, questions continue to roll in, through the website and everything, but also, patients, of course, ask questions every time they're here. But one of the questions that stood out to me was, what is in between a Brazilian butt lift and injections for buttock enlargement? And I guess there's two ways to approach that question. One is, a Brazilian butt lift is injections. It's injections of your own fat. So we do liposuction where we remove the fat from, typically the lower back, upper back, and abdomen. And then we use that then to put back in, and we call that autogenous fat injections, because it's you. You know it's not going to get rejected, but it does have to get revascularized, which means it's got to get a blood supply to deliver oxygen. So when we do that, we talk about a 50 to 60% fat take. That means what will survive the transfer. So that's kind of, like I said, a BBL or Brazilian butt lift is that kind of fat injection. The other is just something you can kind of pull out of the cabinet, and there is something called Sculptra. Sculptra is a volumizer or a filler that we typically use in the face that came out. It's calcium-based versus hyaluronic acid-based, which we see for Voluma or Juvederms or things like that. And it is used as well. And that's obviously something we would use in someone who doesn't really have a lot of their own fat. It can be quite cost prohibitive given how big you want your buttock and how much it takes to fill up a buttock. But in my mind, if people want buttock enhancement, their own tissue will always be the best. So Kybella is there either as someone who just really doesn't have anything, or maybe I have just a little touch up I want to do. Maybe one spot's got a little dimple or a little flatness, and maybe this is a better alternative than kind of going back into surgery, either going to sleep or numbing things up, harvesting fat, and then re-injecting it. But those become your options. Now, there are a couple of off-the-shelf cadaver fat type of products out there, but again, like Sculptra, they can be very expensive because it depends on how much of that product you have to use, and they come in like 5 cc tubes, which is not a lot of volume. So for the face, that may make sense. But for someone really trying to create a buttock or get those wide hips, get some contour in there, it could be a cost prohibitive type of process. But my job's not to spend your money, that's up to you. But just, it's worth having a conversation about. But again, in my practice, for the vast majority of people, like 99.9%, we're using their own tissue. And then I might as well throw in that another way to augment your buttock, if you just don't have enough of your own fat, there are buttock implants to put in, just like there are breast implants. I don't do those implants, but I'm happy to talk to someone if they've got questions when they're trying to decide between their own tissue and a buttock implant, kind of the pros and cons, and maybe we can have that be a conversation for a different video. Well, have a great weekend. Hopefully the rain and the wind's going to slow down, and we'll talk to you next week.